Welcome to Fertility Doc Talk. I'm your host, Dr. Kajal Abrol. I'm a board-certified obstetrician-gynecologist and fertility physician based in Toronto, Canada. My goal is to educate patients, partners, and the public on fertility and to destigmatize infertility. Through this podcast, I aim to increase knowledge and awareness about reproductive health to empower people to make informed decisions about their own fertility. Welcome everyone. In this episode, we are going to talk all about lifestyle and fertility. From environmental factors that may negatively impact fertility, to vitamins and supplements that may help to support fertility, and everything in between. We will also touch on nutrition and exercise choices as they relate to fertility and fertility challenges. Lifestyle factors are generally modifiable or changeable behaviors or exposures that can influence your fertility, but also your overall health, so they are an important aspect of any discussion on fertility. If you are looking to optimize or protect your fertility, it's crucial to look at your habits, your behaviors, and your day-to-day exposures to see if any of them could negatively impact your fertility and thus need to be changed or eliminated. Cigarette smoking is the first factor to discuss. First, let's discuss smoking and eggs. Studies have shown that smoking affects both egg quantity and egg quality, leading to decreased fertility and earlier menopause, up to 2 years earlier than non-smokers. Smoking has also been shown to increase the risk of miscarriage. This may be due to decreased egg quality or the effects of smoking on the uterine lining, or to poorer embryo development. Smoking has also been shown to cause damage to the fallopian tubes, which may lead to blocked fallopian tubes and also an increased risk of ectopic pregnancy. With respect to smoking and sperm, cigarette smoking has been shown to have a negative effect on all sperm parameters: semen volume, sperm concentration, sperm motility, and sperm morphology. Some studies have also shown that this is dose-dependent, meaning a more significant decrease in sperm parameters is seen in people who smoke more. Vaping has become a popular alternative to cigarette smoking in recent years. It is felt to be a safer option for general health, and as such, it's commonly felt to be safer or better when it comes to fertility, for people with ovaries as well as those with sperm. Although there is more limited information about vaping and fertility compared to smoking and fertility, there have been some recent studies examining this relationship. These studies have shown that vaping may negatively affect sperm quality, specifically sperm motility. Also, vaping has been shown to delay embryo implantation and thus decrease pregnancy rates. I would say that research on vaping is still fairly new, and more human studies are needed to better understand these issues. That said, early studies do suggest a negative impact of vaping on fertility. So overall, it is best for anyone planning pregnancy or already trying to conceive to avoid smoking and vaping altogether, to optimize sperm and egg quality and pregnancy rates. Marijuana is another commonly used and reported drug. Since it was legalized in Canada, more people are coming into their fertility consultations reporting marijuana use. Some common misconceptions are that 1, marijuana does not negatively impact fertility, and 2, individuals need to stop using marijuana only once pregnant, but it is okay to use it while trying to conceive. However, studies have shown otherwise. Marijuana may cause hormonal changes leading to ovulation issues in people with ovaries. It may also affect early embryo development and implantation. Marijuana has also been found to affect sperm quality, including lower sperm concentration, motility, and morphology, and it may also affect fertilization. So, it is advisable for anyone trying to conceive to avoid marijuana altogether, to optimize their fertility and chances of pregnancy. Similar findings have also been shown for other recreational drugs, such as cocaine. Although studies are limited, there does appear to be a negative impact on sperm and egg quality and pregnancy rates overall. Both smoking and marijuana use are associated with lower pregnancy rates naturally and with fertility treatments like IVF. Alcohol is another substance that is very important to discuss, given how commonly it is consumed. No amount of alcohol is safe in pregnancy. This is widely known. But what about while trying to conceive? Studies looking at the relationship between alcohol and fertility have shown some conflicting findings. However, there are some good studies showing that increased alcohol intake has a negative impact on fertility, with respect to eggs and sperm. In people with ovaries and eggs, increased alcohol intake has been associated with a longer time to conceive and ovulation issues. In people with sperm, increased alcohol intake has been associated with decreased testosterone levels, sperm concentration, and sperm motility. Increased alcohol intake has been associated with decreased pregnancy rates, naturally and with IVF. So the safest and most conservative option is to avoid alcohol altogether while trying to conceive. But this doesn't always seem reasonable, as the journey to conceive can often take some time. So if you're going to consume alcohol while you are trying to conceive, consider limiting your intake. For all individuals, drink in moderation, with no more than 4 to 5 drinks per week, and no more than 2 drinks on a single occasion. For people with eggs specifically, limit alcohol to the first half of the menstrual cycle, and avoid it after ovulation. Now let's move on to diet and fertility. Many individuals and patients often ask about what diet plan they should follow to optimize their fertility. While there is no one specific food or fertility diet that will significantly increase fertility or chances of pregnancy, there are general food choices that may help to optimize fertility. In general, the Mediterranean diet has the most evidence for having a positive impact on general health and on fertility. The Mediterranean diet is characterized by a diet high in whole grains, legumes, vegetables, fruits, nuts, seeds, lean protein like fish, and healthy fats like olive oil. These foods are rich in antioxidants, protein, fiber, and omega-3, all of which support sperm quality, egg quality, and other aspects of fertility, like a healthy endometrium for embryo implantation. I would like to now take a few minutes to discuss weight and fertility. This can be a big topic to discuss, maybe even an episode of its own, but let's talk about it now, since it relates to lifestyle factors like nutrition and exercise. Many studies have shown that extremes of weight, meaning being overweight and having a high body mass index or BMI, or being underweight and having a low BMI, can affect pregnancy rates and complications of pregnancy like miscarriage risk. I understand that body mass index or BMI is not a perfect tool to assess health outcomes. However, there has been a great deal of research to show a link between weight or BMI and pregnancy outcomes, and it is an objective or measurable tool that can be used to assess and discuss risks. Studies show that pregnancy rates are most ideal with a BMI between 19 and 25. With extremes of weight, being very underweight or overweight, individuals may experience issues with ovulation, as well as difficulties with implantation. For those who are significantly overweight, BMI may also affect prognosis with fertility treatment, because response to medication may be lower with increased weight or BMI. In those with increased BMI, losing weight has been shown to help natural pregnancy rates, as well as response to fertility medications and pregnancy rates with fertility treatment. And you don't necessarily need to reach an ideal weight or BMI to see these improvements. Often losing 5 to 10% of your weight can help improve outcomes. In those with low BMI, pregnancy rates can also be improved by increasing weight. This leads to our next topic, which is exercise. Exercise has been shown to have several benefits with respects to fertility, including improving blood flow to the reproductive organs, reducing stress, and helping to improve self-image and body image. It may also help with weight loss efforts in those with a high BMI, which in turn improves pregnancy rates and decreases miscarriage rates. As good as exercise can be, moderation is key. Excessive exercise may impact BMI, leading to a very low BMI and ovulation issues. It's important to review your exercise regimen with your physician if you're seeking fertility treatment. There may be times during certain fertility treatment, such as IVF, when your physician may advise against exercise. For example, once the ovaries are being stimulated, they grow in size and there can be a risk of ovarian torsion, where the ovaries can twist around and block the blood supply that feeds the ovary. This risk may be increased with certain types of exercise, specifically high-impact exercise, where there is jumping, twisting, or bending. As such, many physicians will advise against exercise during ovarian stimulation in IVF, and for a short time afterwards, to give time for the ovaries to shrink back in size. Now let's move on to discuss vitamins and supplements and fertility. Do you need supplemental vitamins for fertility? And if so, which ones? First, let's talk about supplements that may be considered in people with ovaries. A prenatal vitamin is recommended 3 months before trying to conceive. A well-balanced diet with whole foods can help ensure you get the vitamins and minerals you need for pregnancy, and a prenatal vitamin can help supplement this. The most important component of a prenatal vitamin is the folic acid, which can be taken on its own or as part of a prenatal. You want at least 0.4 milligrams of folic acid daily, which is the most common dosing found in prenatal vitamins. When taken on its own, folic acid is often found as a 1 milligram tablet. If you have risk factors for a neural tube defect, you need 5 milligrams of folic acid daily. High-risk individuals are those who have had a previous pregnancy affected by a neural tube defect, or have a neural tube defect themselves or in their partner. Both a prenatal vitamin and folic acid should be started 3 months before trying to conceive, continued throughout pregnancy, and for 3 months postpartum. Aside from folic acid or a prenatal vitamin, vitamin D is another important vitamin for fertility. Optimal vitamin D levels may help improve pregnancy rates and may be associated with improved implantation. Depending on where you live in the world, you may be deficient in vitamin D. This is quite common here in Canada. Many people will start to take vitamin D supplements on their own. 1,000 to 2,000 international units of vitamin D daily are often enough. To be sure you are taking the correct dose, you can have your primary care provider test your level so you know your starting point and can reassess this after supplementation. Vitamin D can be taken while trying to conceive and during pregnancy. Coenzyme Q10 or CoQ10 is another supplement that may be considered. Studies have shown that CoQ10 may help with egg quality. This is often recommended in individuals with ovaries who are over 35 years of age, or any patient who has a known or suspected egg quality issue. 600 milligrams of CoQ10 can be taken, usually in the morning, so that it doesn't affect your sleep. CoQ10 can be taken while trying to conceive, but should be stopped with a positive pregnancy test, as safety in pregnancy is not known. DHA is another supplement that may be considered for egg quality. It is an omega-3 fatty acid. It is found naturally in many foods, such as fatty fish like salmon and tuna, chia seeds, fish oil, flax seeds, walnuts, and egg yolks, but it can be taken as a supplement at a dose of 300 milligrams daily. DHA can be taken while trying to conceive, during pregnancy, and postpartum. Inositol, or myo-inositol, is the last supplement I'll discuss. Recent studies have shown that it may help to regulate ovulation in people with PCOS and insulin resistance. But it has not been shown to be more effective than prescription medications for ovulation induction. So it may be a good starting point in people with irregular cycles, thinking about pregnancy or waiting to see a fertility specialist about ovulation induction. 2 to 4 grams daily is the usual dosing, depending on how you tolerate it. Inositol may be taken while trying to conceive, but can be stopped once pregnant. Now let's talk about supplements that may be considered in people with sperm. There are a handful of vitamins and antioxidants that have been shown to help repair sperm and improve sperm parameters when sperm abnormalities have been noted on a semen analysis. Before considering these supplements, it's crucial to look at and improve lifestyle factors first, including smoking, recreational drug use, alcohol intake, and heat exposure like hot tubs and saunas. Because there's really no point in trying to repair the sperm if you're simultaneously causing damage to the sperm. The supplements that have been shown to help repair and protect sperm include vitamin C, vitamin E, selenium, zinc, folic acid, L-carnitine, and coenzyme Q10. Now let's take some time to go through some common questions I hear about these various lifestyle factors to better understand what changes you can consider or choose to ignore when trying to optimize your lifestyle and fertility. First, in keeping with our discussion on diet and fertility, do I need to adopt a gluten-free diet or a keto diet? Unless you have celiac disease, which is an autoimmune disease associated with gluten ingestion, there is currently no great evidence to support that a gluten-free diet will significantly improve fertility. The same applies to a ketogenic diet. Another common question I hear is, can I drink coffee while I am trying to get pregnant? Or, should I stop drinking all coffee and tea while we're trying to conceive? Well, not to worry. It is not necessary to give up all caffeine while you are trying to conceive. This includes coffee, tea, and various soft drinks. Current recommendations by the SOGC, or Society of Obstetricians and Gynecologists of Canada, are that 1 to 2 cups of coffee per day are safe during pregnancy, while ACOG, or the American College of Obstetricians and Gynecologists, specifies that caffeine consumption in pregnancy should be less than 200 milligrams per day. When it comes to fertility, some studies have shown that increased caffeine intake, usually greater than 200 to 300 milligrams per day, may lead to a longer time to get pregnant and increased miscarriage rates. As such, it's generally recommended to limit caffeine intake to under 200 milligrams daily while trying to conceive. The last question I want to address is a really important one, as it has recently been a popular topic on social media. This question relates to the type of folic acid to take when trying to conceive. What I am often hearing now is, I read that it might be better to take methylfolate instead of folic acid. Is this true? Folic acid and methylfolate are not the same thing. Both of these are types of folate, or vitamin B9, but they are not the same. Folic acid is an important supplement for pregnancy, needed to decrease the risk of a neural tube defect, a problem with the brain or spine in a developing baby. Many studies have shown that folic acid helps to decrease this risk of neural tube defects. The same cannot be said for methylfolate, which is sometimes listed on supplement labels as 5-methyltetrahydrofolate or 5-MTHF. Recently, there have been concerns that individuals with an MTHFR variant may have trouble absorbing folic acid and an easier time absorbing methylfolate, and should therefore take methylfolate in preparation for pregnancy instead of folic acid. But there is actually no scientific evidence to support this recommendation. All studies looking at reducing risk for neural tube defects are based on folic acid supplementation, not methylfolate supplementation. And numerous medical societies and organizations recommend and support this, to take folic acid to decrease the risk of a neural tube defect in a developing baby. This includes the Society of Obstetricians and Gynecologists of Canada, the American College of Obstetricians and Gynecologists, and the CDC, or Centers for Disease Control and Prevention, just to name a few. If you are taking a prenatal vitamin that only contains methylfolate, it would be advisable to also take a folic acid supplementation alongside the prenatal to ensure you are covered. So there you have it, an overview of lifestyle and fertility, from alcohol and drug intake to diet and exercise choices to vitamins and supplement support. There is a lot to consider when trying to optimize and protect your fertility, and it is easy to get caught up in all the supplements you hear about and all the advice from family, friends, and the internet. So I hope this episode was useful in allowing you to better understand the various environmental factors that may impact your fertility and the dietary choices and supplements you can consider to support your fertility. That's it for this episode of Fertility Doc Talk. I really hope you enjoyed listening and learning and feel empowered about your reproductive health. If you enjoyed this episode, please remember to subscribe to the podcast and tune in to our next episode.